Welcome to Rare Meat for Moms, parenting tools and life hacks for raising a child with a rare diagnosis. I'm your host, Meghan Weaver. Let's get to the meat of it. Welcome, everyone. Today we'll be talking about Invisalign, specifically for children with special needs. My guest is Tammy Ruh, who has 14 years experience as a dental hygienist and is also a special needs mom. Her son Hudson and my daughter Rowan are about the same age and shared the same diagnosis of GAND. When she told me that they had had success with Invisalign, it blew my mind and I had so many questions. We're going to dive into those today. Welcome, Tammy.
Thanks for having me.
Yes, I'm so excited. So I want to dive right in. I know GAND is foreign to so many people. If you could just talk about some of the characteristics that Hudson experiences that makes any type of dental work or dental cleaning a challenge and how you've been working through that over the years. Tell us a little bit about Hudson.
Yeah, Hudson, he just turned 11. So he has GAND, like you said. So it really impacts his fine motor skills. So using a toothbrush is really hard for him. We're working at it. We've been working at it for a while. He kind of just puts it in his mouth and kind of like jiggles it around a little bit. We like to have him try it first, and then I go back in and I'm able to do it. He won't let me floss. We have not worked up to that, but we're trying the best we can. We have tried an electric toothbrush with him. He doesn't seem to like the vibration of it. We worked when he was in ABA. We tried to get him used to the vibration. We just never mastered that. So we went back to a toothbrush. We actually found a surround toothbrush, it's called. So the bristles go around all three sides. So it's on both sides of the toothbrush and the top. So you can kind of brush a little bit faster. And I find that works really well for Hudson. Another thing with him is like for dental cleanings, we have a really tough time. I'm a dental hygienist. So I've tried me doing the cleanings. I've tried having someone else. I've even had the dentist. He doesn't like to sit still long enough. And he doesn't like that vibration again, going back to that. So that's still been a challenge. I've tried taking him more often than 6 months to get him used to going. So that is a big struggle at our house. And I think he has that white coat, but he's had a lot of blood draws and he's just a little nervous to go to the dentist. So it's been challenging, but we're trying to work through that the best we can. We found it's not even my dentist. I found one that works specifically with kids with special needs. And I know you're supposed to go every 6 months. He just gets so worked up that we just go once a year and he does the best he can for a cleaning. And we just work around it and try to do the best we can for Hudson with what he can tolerate.
That's great to hear, especially with your background that I couldn't be doing anything more than what we're doing because we have the same experiences, the white coat fear and just stepping foot into that office. And our dentists have been great saying, when you bring your other children, if you'd like to bring Rowan, then we'll just look in her mouth when they're there for their checkup and she can see what they're doing. I don't like to do that all the time because I do need to pay attention to what they're telling me about and be there for my other children. But we have done 2 sedations and like you said, there's so much fear. But one thing I will share is that she's only been sedated twice for these cleanings and they'll do everything in that one appointment that needs to be done, whether it's filling cavities or x-rays and all of that. But we also will do blood draws during that sedation. That's been really helpful because she will vomit and it's impossible to do a blood draw on her when she's awake. So that is one thing that it's been nice to be able to ask her pediatrician, what do you want to look at? And I'll go get the tubes and the anesthesiologist will do the blood draw. But yeah, we have not been able to do a regular checkup without sedation yet. I am really interested to hear about the process of Invisalign. We now use the auto brush, which, like you said, goes around all 3 sides. That initially, she was not going to have it. But we asked her good friend who told us about the auto brush if she could send a video of her daughter using it. And her daughter's dancing to it. And so now we play that video and now Rowan will use the auto brush. So we are having some success with that. But also not flossing, but her teeth are pretty far apart. So we haven't felt the need to make that a priority just yet. Tell me the process and like when you started having that conversation with the dentist and then the orthodontist around what this might look like and what the options would be.
The orthodontist really says about at age 7, you should be checking in with the orthodontist to see if they need some sort of orthodontic treatment. But we just didn't know if that was ever anything we could do with Hudson. So around, I think it was around like 7.5, 8, he actually lost one of his, I think it was his eye tooth. It was a top eye tooth. It was something prematurely. He had a little bit of an accident. He lost it. I just noticed that there was shifting going on and his front teeth were starting to drift to fill in that space. And he had this big diastema between his front teeth. And they started to, I think with his tongue was pushing out his front teeth a bit. So we even noticed a little tilting. So that really concerned me being in the dental space. I had been an orthodontic assistant before I went to hygiene school. So I knew kind of signs. I had talked to some friends that were nurses and they said, if you don't treat these problems when they're younger, they're going to be big problems when they're older, like a lot of dental surgeries, like just big stuff. So I thought, okay, I'm going to get on this. So I actually was just at the orthodontist with my daughter. I knew he had done work with special needs kids before. He had donated his time. And so I just asked him, can you just look in Hudson's mouth? And so he looked, he's like, yeah, you know what? He needs some teeth extracted. Has a lot of crowding. So that was a big problem with him. He was having the space on the top, but the bottom was all crowded up. He said, I need you to go see a pediatric dentist. So we went to see a pediatric dentist and she said, yeah, you need 5, 6 teeth extracted to make room for these permanent teeth coming in. And I'm in Wisconsin. And he had to see a special doctor that had privileges to do sedation dentistry at our children's hospital. So they referred us to another pediatric dentist that I found that did special needs. And that's who he currently sees. And he agreed to work with this orthodontist. And so even during the surgery, the doctor actually had the orthodontist, okay, I'm going to have my day really light on this day so I can answer any call that he has. So they worked together during the surgery, sent pictures or videos. I'm not sure exactly what they did, but they were able to extract some teeth to make room for these permanent teeth. But with taking out these teeth prematurely, it was leaving all the space. It was going to happen if I didn't do anything to maintain this space. I think we let it heal for maybe a few weeks or a month. And then we went to see the orthodontist. And he did digital x-rays. That was another thing I knew being in the dental field, he would not tolerate leaving impressions, that goopy material in his mouth for 45 seconds, a minute. It would just be a disaster.
Right.
They said,
what does the digital x-ray look like?
so it basically looks like a big wand. And for a typical kid, like when my daughter goes in to get her teeth scanned every few months when she was in the Invisalign, it would probably take, I don't know, 2-3 minutes to scan both arches. It's a big wand. You just go tooth by tooth. You have to get all the surfaces and it goes to this TV. They can see if they've gotten all the surfaces. Hudson, it takes an hour plus to get a full scan, but I knew it was another option out there. Just being in the dental field, I'm like, okay, let's try it.
So does he sit in a chair for that or sit in your lap? Or if you're going to be there for a full hour, what does that process look like?
Yeah, so we started out trying just to do it in their dental chair. First of all, they did not put us out in the big room that had 10, 15 dental chairs. They knew for Hudson that was not going to work. They needed the same dental assistant working with him every time that was really patient, that he knew, that he liked, and then a closed off room. So they put him in the consult room that had a chair. I know maybe not every dentist office would have that, but it was really helpful for Hudson. And they would just slowly scan the teeth. The first scan took actually 2 visits. He got wiggly. He just couldn't sit. He wasn't used to it. So they were really great. They said, okay, let's try it next week. And we'll try, since we got the lower arch, let's try the upper arch next time. So they were really patient and willing to work with us. I think that was really key. But they took these impressions. We got them. I was so impressed. The doctor said, we're not going for perfection for Hudson's Invisalign to get the perfect teeth, but we want teeth that can accommodate all his permanent teeth. And he really needed palatal expansion. So Invisalign really isn't meant for palatal expansion, but he's, you know what, this is the option. We knew we couldn't get traditional braces on him. I'm like, you'd have to sedate him every time. You'd have to do anything.
And same with an expander, right? That would be to fit for a traditional expander and then turning the key and.
Exactly. And I'm like, I don't think he would tolerate that. I'm going to talk to Invisalign. We're going to see if we can just do this pro bono and see if the treatment works. We don't even know if Hudson's going to wear these. So let's just try it. And I'm like, if you're willing, I'm willing, let's do it. So he actually talked to Invisalign and the dentist donated his time. And then Invisalign actually did it pro bono. One thing I will mention with Invisalign that just came out a year ago that wasn't even an option when we started is Invisalign does do palatal expanders, which is great. Another great option for our kiddos, I think.
Yeah.
For Hudson, he needed, though, that space maintaining aspect to it as well. So he needed both. But yeah, so they just work together. He's really great with talking to the pediatric dentist and just making sure things are progressing as they should.
What's the timeline? How long will he be in the trays?
Mm-hmm.
I know every child is different, but I know with my own kids with their orthodontist appointments, we are going pretty frequently for adjustments. And how much are you able to say, can we skip this appointment? Can we do this at home? Or is this going to be, like you said, broken up into multiple appointments if it doesn't go well? Because I know for Rowan, they're the same age and I can see that her 12-year molars are coming in, and I don't know how that will affect the shifting of her teeth. She does have the crowding on the bottom and then larger spacing up top.
Mm-hmm. And every treatment is so different by kids, so it's hard to standardize it. For Hudson, I can tell you what his treatment was. So he started when he was about 8, and he had about 2.5 years of treatment. They call it phase 1 is what he had. And so we got that palatal growth. We're maintaining that space for those permanent teeth to come in. He was wearing it every single day during active treatment. They say if you can at least wear it, I think for Hudson, they had it like less expectations because of everything that was going on. But let me tell you, he wore these trays more than my daughter, my typical daughter, when she was where I'd have to be on her about that Invisalign. Hudson was so good. And
Wow.
his behaviors we're still working on these behaviors. And I didn't even know if Invisalign would work. And I just think our kids really, they surprise us and they can do a lot more sometimes than we think they can. So he wore them all the waking moments, except when he was eating. And then when he went to bed, he just wear them at night. He would actually ask if we took him out after eating, he would go on his little talker and say, teeth, please. And he knew it was time to brush his teeth and put them back in. And I guess that's another point I have to say with Invisalign. Before Invisalign, it was a little bit of a struggle to get him to brush the teeth we were talking about. But after getting them, it is such a routine that we were brushing his teeth after every snack, after every meal, which sounds like a lot, but we just put toothbrushes around wherever we would be.
Right.
And he's so used to it. His teeth are an excellent. He hasn't had any cavities now. We had to get a few sealants, one like little cavity when we had the extraction, but his teeth, I look at him being a dental hygienist, I know what a cavity looks like. And they're so clean just because we brush them so many times a day. Now that we're after the 2.5 years, now we just go to nighttime wear. And I feel like, oh, I don't brush his teeth as much. And it bothers me a little bit because we got in such a routine. And now he loves brushing his teeth. So it's just part of it.
Wow. Because for me, there are certain things that Chris will do. He's in charge of calling and fighting with insurance, and he's also in charge of brushing her teeth because it can be a fight. And so that alone is a great goal to have that hygiene autonomy and that she would want to brush her teeth and it wouldn't be a fight. And the thing that I want to pass off to him because it's just at the end of the day, I don't want to deal with it. But
Mm-hmm.
I love hearing that because I've never had Invisalign. I've seen that they clip in.
Mm-hmm.
Does he leave? In the beginning, did he leave them in, or does he know how to get them out?
And that was another thing. We didn't know how he would react to the sensory, to leaving them in. I have to say they clip in pretty good. So, and his fine motor skills aren't great, which this actually worked to our advantage because he really couldn't get them out. He couldn't get his fingers under there and pull out. By the end, he definitely could. But they fit really pretty snugly. At the beginning, it was, what's in my mouth? We were a little bit worried, like the speech was like, how is this going to affect his speech? Because that's another thing that's hard for our kiddos is speech. And he really got used to it. It probably took him a few weeks and it was just part of his day. His speech was totally fine, not impacted. They're a little bit looser now that we're in the retention stage and he can get them in and out by himself. And I say, give me your teeth. every morning or we eat. I'm like, Hudson, give me your teeth. And he puts them in my hand. And then after we eat, it's honest talker, teeth, please, because he wants his teeth brushed.
I love that. So my concern, and maybe you can, does he chew like on a chew necklace or anything like that? I would be concerned that she would take them out and chew on them.
Oh, no, he's not a big chewer. He will stick his thumb in. He has this little habit that never affected it. But no, he's never done it. He's not a big chewer on things like that. So I don't know if that would be an issue or
Okay.
not. Mm-hmm.
Well, I was worried that she would pull them out and then they would be wrecked because she would chew them or lose them. But it sounds like in the beginning, they stay put.
Yes. And I have to say, you're changing these retainers. Every treatment's different, but for us, it was every week. So once a week, we had 1 day a week that we knew, okay, we get our new one and they're going to be snug at the beginning. And then as the week goes by, they get a little looser because things are shifting. And then you go to the next one. And another nice thing is if we happen to lose one, then we just jump the next one. So it was a whole box of them. Oh, and going back to the whole treatment, we did have to go back into the orthodontist every about, I don't remember exactly how many months, but it was maybe 4 or 5 months to get scanned, just to make sure everything's lining up how it's supposed to, and then they can get you new Invisalign. So there was that part of going back to the orthodontist, but it wasn't like traditional braces where you were going every 5-6 weeks.
Can you talk me through what the process would be in getting it pro bono?
That, I don't know, I think I just lucked out, to be honest, with our dentist. I think a big thing is having a good relationship with your orthodontist. Maybe it's a orthodontist your kids are seeing, or you ask other, especially it's moms, if you know of a doctor that is really good with special needs. I think finding an orthodontist that is really wants to help you and is really patient, I would say, and just willing to help you and willing to want to work with you. That's really important. But I would say asking around to other special needs moms might be another good option.
And then they contacted Invisalign to see if they would donate, or you contacted Invisalign?
They did it all. They did everything. He does a lot of Invisalign cases, so I think he has a really good relationship with Invisalign. So I don't know if other people would get it for free or not. Again, they were doing it almost experimentally with Hudson to see, will Hudson wear it? Number one, we weren't sure. I'm not going to have you pay thousands of dollars, and Hudson won't even wear it. And two, will it expand things? Were you not using it in the traditional way? So I think it was just them working together with Invisalign. Invisalign was willing to do it. I do have to say I did some digging because I know the dentist that we're going to see, like I said, has done other cases. He has done traditional braces for kids with Down syndrome and all that sort of thing. So he works with an organization. But I did some Googling, and there are organizations out there that do grants for special needs kids to do orthodontic treatment. So I'll definitely get those to you, Megan, so you can share them with everyone else. And hopefully that might help someone.
That's perfect. I know that you're really good at digging and finding these things. So I will put them in the show notes and I'll put them on the website as well. But I think it's a great reminder that it never hurts to ask.
Exactly. Yes.
Do you have anything else that you think would be encouraging, or just some of the things that popped up during this journey that were surprising?
That were surprising. I was just surprised at how well Hudson did. I guess nothing really. Actually, once we got started, it just became routine, and it was just normal. Everything with the putting them in every morning, brushing the teeth. The school, I have to say, was excellent with Hudson and really supported us with Invisalign. So I went in there and I talked to them, showed them, and asked, will you brush his teeth after every snack, after the meal? And just told them the importance of it. And me being a dental hygienist, I think they understood. So they were really great. And Hudson knew after every snack, after every lunch, and they had him actually helping, like I was saying. I think that helped his fine motor skills doing that. And just Hudson loves routine. So just being able to carry it over from home to school was really important. But I just think it's a great thing. Clean teeth are great. And on that note, I think just doing, again, that early intervention is really key to having bigger issues down the road. Some kids might have perfectly straight teeth, great genetics. A lot of our kids don't. I noticed with Hudson, I don't know about your child, Megan Rowan, but Hudson had the weirdest eruption pattern of his teeth. Like he usually get your lower two front teeth. Hudson got, we called them fangs for a while, his upper canines in
Yes.
first. It was so weird. And I was talking to my dentist I work for. I'm like, this is so odd. Like we were trying to take a pan on a 1-year-old, which was challenging to me. I'm like, does he have any other teeth? But he had all his teeth. They were just coming in the Hudson way, not the traditional way. So I think that kind of played a part too on just everything that was going on with the spacing, losing teeth. But I do know, just being in the dental field, being in having that orthodontic background, that early intervention just prevents bigger problems down the road. And if whatever you can do earlier, it just makes things way easier than down the road. You might not even need a phase 2 if you do phase 1. A lot of times I see.
Our son, he just started phase 1 and he's 9. And after 4 days, the bracket that was like the wire went way up. And I thought, wow, that's going to take a while to pull that down. I was like, 4 days, 5 days, I think you're done with phase 1. They move so quickly because they explain it that it's Play-Doh and you're just able to manipulate the teeth so much easier when they're younger.
Yeah,
So I think about all the times that when she was much younger, and I think about, oh, what's it going to look like when she has a loose tooth? And is she going to freak out about losing one? And your mind spirals to all of the what ifs and how's it going to go? And I think just hearing that it was no big deal and just became part of day-to-day life, it's a reminder that all these things that we worry about, we probably shouldn't worry about until we try it and then we see how it goes.
exactly. Definitely. But yeah, like the palatal expansion when you're young, it's so much easier just to expand it like more naturally versus when you're older, they have to do like surgeries and very uncomfortable for the person getting that done. And I just think too, with lining things up a little bit better, your oral hygiene is so much better. You can just clean things. You're not going to get as much buildup, periodontal disease. All of that gets lowered just by having straighter teeth. So even if the teeth aren't perfect, like that's not our goal with Hudson to have perfect teeth. But if they're straighter, where we can just get things clean, I think that's going to help them in the long run.
I just can't thank you enough for sharing because you had started telling me about this and it blew my mind when you told me that you guys had gone the Invisalign route already. So I so appreciate you talking about this. And I want to end it with our 3 good things. So if you have 3 good things to share, I'd love to hear them.
School's back in session. That's my number one. Summer was a little tough at the end of it, but so happy. School's going good. Hudson just turned 11 on Sunday, so we had a little birthday celebration. And then my third one is me and my husband are going on a little weekend cruise coming up pretty soon. I think it's so important for us special needs parents to get away and just reconnect sometimes and have some of our own time. So I'm looking forward to that.
Absolutely. I feel like we're living parallel lives because Rowan's about to be 11 and I too am excited for school and Chris and I are hoping to get away this next week. It is so important to have that time. So I'm so glad that you guys are getting to do that.
Yes. What are your 3 things?
My 3 things, well, that the hurricane is not going to be hitting the day that we leave.
Yeah.
Like it was last year. So we canceled our trip to go away together last year, the morning of our cruise. We had to cancel. School was canceled, all of the things. And so my good thing is that it's supposed to be here on Thursday and we're supposed to leave on Sunday. So we have some time.
Nice.
We're going to the desert this time because we want to get away from all of this rain. That's my first one. My second one would be that my teenager just told me a joke the other night, and it just keeps me laughing as I think about it. Her math teacher told her this joke, and I'll tell it to you. Why do girls travel in groups of 3, 5, 7, and 9?
Why?
Because they can't even. It's so ridiculous. But when she tells it, she's like, Mom, because they can't even. So, anyways, I just keep thinking about that because we are so in the teenager phase with her right now.
I have a 16-year-old.
Yes, exactly. So I know you can relate. And the third one, I think is just that we have our sitter coming in town from out of state. She had given us this date in that everyone is still healthy and she's still coming, and that I think having that person stay with your kids that you trust, it just helps you enjoy that time even more. So I'm so thankful for her. So she is my third good thing.
Oh, that's awesome. I love it.
I really hope that you can come back on and share knowledge about so many other things, because you're also a travel agent for special needs families, and you do the great digging to find all these grants. And so I hope we'll be hearing more from you about all of these other topics. But I so appreciate you sharing your journey with Invisalign,
Yeah.
because it's very inspiring for me to start that conversation with Rowan's dentist.
Yeah. And I think everyone deserves a great smile. No matter if you have special needs, you don't, nonverbal. I think just everyone does.
Absolutely. I'm going to be sharing some of the pictures of Hudson and his journey from before treatment and during treatment on the website, so everyone can see the progression there.
Sounds great. Thanks.
Thank you so much for listening today. You can find all the resources Tammy referenced in the show notes or on my website at meghanweaver.com. I hope you've enjoyed today's episode and are more encouraged about the possibilities with orthodontic intervention for your child. Thanks for listening to Rare Meat for Moms. I'm Meghan Weaver. Until we meet again.